Morning, everyone. Hi, thanks for joining us. I'm Andrew Schiff. I'm the CEO here at the Food Bank. We're here this morning to release the Food Bank's 2019 status report on hunger in Rhode Island. We're very happy to have Senator Reid and Senator Whitehouse with us this morning, and in a few minutes you'll be hearing from both of them, along with Andrew, the director of WIC in Rhode Island. In a perfect world, everyone in Rhode Island would have 3 healthy meals a day. Access to good food is essential for good health. For children, access to good food is essential for them to grow and develop and learn. When we make sure that everyone in Rhode Island has access to 3 healthy meals a day, we're protecting the huge investment that we've made in education and healthcare. Unfortunately, thousands of low-income Rhode Islanders miss out on meals because they can't afford adequate food. The status report highlights a significant meal gap in Rhode Island. Low-income Rhode Islanders miss out on 6% of the meals that they need in a year. That totals up to more than 11 million meals. The graph right here, it's on the front of the status report, shows the source of meals for low-income Rhode Islanders. They purchase food with their own cash, with SNAP benefits, with WIC benefits. Their kids are able to get free school lunch and school breakfast. And we know that many low-income households also depend on member agencies of the food bank for food assistance. So this chart makes 2 points. One is that the main source of meals for low-income Rhode Islanders are the federal nutrition programs. And also that even with the federal nutrition programs and all of the help that people receive from charitable programs through the food bank, low-income Rhode Islanders are still missing millions of meals. But this year we had the opportunity to survey folks who were coming for help at food pantries and meal programs in Rhode Island. We did this with the help of the Hassenfeld Child Health Innovation Institute at Brown University. And we learned that the people in line at food pantries are mostly either parents with young children or senior adults. So children and senior adults are our most vulnerable citizens and the ones who are most harmed by hunger. The senior adults that we serve have low fixed incomes and can't afford basic household expenses, including food. The families with children that we serve are headed by working parents who aren't earning enough to be able to provide their families with the food they need. We discovered that the population served by the food bank has seriously compromised health. Households reported high levels of illness and chronic disease, including diabetes and hypertension. Along with the human suffering caused by poor health, there's also a financial cost to society. Researchers at the CDC found healthcare costs associated with food insecurity in Rhode Island cost $160 million a year. The results of our survey showed that the vast majority of Rhode Islanders who rely on food pantries and meal programs are enrolled in SNAP. 75% are enrolled in SNAP. That's a good thing. But they also told us in the interviews that the SNAP benefits don't last long enough. For most people, their SNAP benefits just last for 1 or 2 weeks, and then they have to turn to food pantries for help. The underlying problem is that SNAP benefits haven't kept up with the real cost of food. One way to close the meal gap is to recalibrate SNAP benefits to match the actual cost of food today. Unfortunately, the Trump administration is moving in exactly the opposite direction. During the past year, the administration has made 3 major proposals to cut SNAP benefits and eligibility. Right now, 148,000 Rhode Islanders are enrolled in SNAP. One proposal by Trump administration, aimed primarily, believe it or not, at families with children, would take SNAP away from 11,000 Rhode Islanders, including 5,000 children.